Okay. Ajit, so just now we saw an acute case, and I would like to conclude it. First of all, yeah.
We have differentiated at large many remedies in this acute case. And the acute remedy for the corresponding totality is Bryonia alba. Bryonia alba covers every point. Very typical of the Bryonia is something interrupting comes up during the progression of the disease in Bryonia. Some people, they interrupt my rest. They interrupt my space. So that concept you are likely to receive during the progression of a disease. Here, light aggravation and noise aggravation started coming up as interrupters. This is very typical of the bryonia. Then pressure amelioration. If you know headache, pressure amelioration is very typical, which is covered. Then comes a very characteristic symptom about pain in the chest during inspiration, which is also covered very well. And as I told you, the thirstlessness character, which we don't think. We think of gelsemium, we think of Naxwamika, but we don't think that thirstlessness during fever could be bryonia also. So if you take into account all the symptomatology, bryonia fits in very well. There is one more thing which is very important. We have been taught that bryonia is a rest amelioration and motion in general, motion slight aggravation. I admit, but I have found some bryonia where they feel better in rest, but they don't like the rest for a long time and they want to move. Maybe their hands they want to move, their legs they want to move, and this is also a feature in this particular patient also. Under motion amelioration, there is also bryonia. And in bryonia, there are three modalities about motion amelioration. First, fibrous pains. When there is a keloid formation, when there is a scar tissue formation, or when there is a fibrositis, you will find bryonia patient feels better by motion. Second thing is the pain in the teeth is better by motion. Just walking in open air ameliorates the pain in the teeth. And the third symptom is moving the legs cause lessening of the pain in the legs. So this is from the original data coming from the Allen's Encyclopedia of Material Medica. So you will find that this motion amelioration part of the bryonia is also not being paid attention to. You see what happened in between. We started developing the Materia Medica based on individual propensities. Like this is my keynote, this is my keynote. And then we lost the big vision which came through the drug proving. So I think in order to give justice to the remedy, we must have a total vision of what provers, what the healthy volunteers gave to the profession. Then we will have an individual instance of a case before us being justified as far as this is the data and this is the corresponding data with the aid of the repertory or without the aid of the repertory. So bryonia in this case matches at all levels of the operation, including the sensitivity, including the symptomatology. The picture is not a very strong picture, which also matches with bryonia, with some definitive modalities and the concomitants. So my first choice will be bryonia. I want to give it in 1 m potency every 4 hours for 2 days, and after 2 days I would like to see the response of the patient.
And of course, if response will come before we will announce, we will inform you.
Yeah, yeah.
And few words about this differential diagnosis of symptoms. We would think about other remedies. Not, maybe this is a symptom of bryonia. Sounds. Anyhow, somebody can think about other remedies in this case, like root stocks related to motions, or
Yeah, why not? Why not? Rustox always comes as a remedy, and Rustox and Bryonia relationship is of many types. First, Rustox follows Bryonia very well. So it is a follower. You remember, motion are two opposite modalities. Therefore, they are regarded as antagonistic remedy. This is not right. The original data has given that Rustox follows well Bryonia. This is point number one, which we have given in our absolute mathematica. Second relationship between Bryonia and Rustox is they are counterparts of each other. Do you know the meaning of the word counterpart? For example, Indian Prime Minister met his counterpart, German Prime Minister. What is the meaning of this? The meaning is that Prime Ministership is a similarity concept at the prime level. Then rest of the symptoms, they could be opposite to each other. That is the word counterpart. So here Rustox and Bryonia, they share so much symptoms in common at the prime level that they become counterparts of each other. And in counterparts relationship, there is a similarity. So naturally, Bryonia cases can turn into Rustox. Rustox cases can also turn into Bryonia. Now, what is important is the restlessness which you see in Rustox. This is basically because Rus pathology causes agitation of the entire system. This entire system becomes agitated more at the musculoskeletal level in Rustox. It is very interesting. In Zinkum, it causes irritation, it causes restlessness at the central nervous system. In agaricus, you also get the same process at the central nervous system, whereas in arsenicum, you get at the mind level. So even if you take restlessness, it has its own way of presentation. Take bromium, for example, coming from the halogen. It makes the entire system agitated. So during you see a chronic mental picture, you will find bromium presenting to you the iodine-like picture, which is close to arsenic-like picture also. So if you take the restlessness part, in this case, it is not strongly developed. And this is one of the reasons why I wanted to take Bryonia first and Rustox later on, because there are few symptoms which are matching also Rustox, like amelioration from the motion. But actually, the system's language is not of Rustox. So you see, energy of the system's language as expressed at many levels, and the symptoms which the patient gives you, they are to be correlated with each other and make an integrated totality and see the stage of the disease, miasm which is involved. Then the remedy becomes more clear. Otherwise, with symptoms, you are lost because symptoms are of many types. Symptoms are opposite in one remedy. So it becomes a very difficult process. So don't go away from the system's language. See how the patient manifests the symptoms locally and generally, and then go for the selection of the remedy. Then it's a very easy process to understand. Yeah.
Very easy process. That's what we are thinking. And Ajit, 1, 2 sentence about 1M and the frequency.
Yeah. Usually you see in acute cases, I use 200 or 1M. In this case, 1M is there because she's a young lady to tolerate, and the disease is active. I mean, the muscular pains are there, the throat irritation is there. Uh, so, because of the activity of disease process to meet the susceptibility which has been altered, repetitive doses of the 1M will satisfy the susceptibility in a far better and early way. So this line of thinking is more in connection with what Borland presented in pneumonia, for example, where he found that in acute cases, the more you go for 10 m, 50 mcm frequent repetition, you have early response to the remedies. And very few cases he presented with a crisis issue. Most of them were with a lysis issue. So one impotence is selected because it is not a strong pathology, it's a functional disease. She is young enough to tolerate the doses. So her susceptibility is good. She is able to give you modalities and symptoms, light aggravation, noise aggravation, then pressure amelioration, headache, then a lot of other symptoms together. So her susceptibility is increased. So in all cases of acute, when the susceptibility is increased, it is always better to go to hypotension. This is what Stuart Close also presented in Logic of Homeopathy long back. And now in my book on homeopathic pathology also, a lot of new ideas were given to the profession. And my third enlarged edition, I hope will appear within a span of 6 to 8 months, which is more than 150 pages with a huge data about pathology and a lot of conditions which arise in the follow-up also. So
I
one impotency, yeah, in this patient is selected because of increased susceptibility, increased sensitivity, and the disease process being active and young age.
great.
Yeah.
Ajit, I hope that the case will will I mean this patient will doing well, and we will inform you and our listeners
Yeah.
about it. And I hope you will include this case in your new edition of pathology book.
Yes, yes,
We
yes.
wish a very fast
Yeah.
recovery for our patient, and a good night to you, and see you tomorrow.
Yes.
Thank you very, very much.
Okay, yes.